Kidney disease affects approximately 37 million American adults, and 33% are at risk, many of whom don't even know that they have kidney disease. Now, how does kidney disease occur? It occurs when the kidney becomes damaged and it cannot perform its function due to several reasons. In this week's Health Exchange chat room, my guest and I will debunk all things related to kidney disease. My guest is Mrs. Funke Bajomo. She's an event decorator, a freelance writer, and a mother of three. Our chat is going to dive into an overview of kidney disease, the risk factors, symptoms, complication, diagnosis. Definitely we'll talk about management in terms of prevention and treatment, and we're going to end up debunking the myths. I'm Dr. Babs. Welcome back to another episode of Health Exchange Chat Room with Living at Your Finest with Dr. Babs YouTube channel. I am a board-certified family physician, health and fitness coach, and the proud owner of Living at Your Finest company. I am a woman that is truly pleased and honored that you are watching this video. You are investing in your health. Thank you so much. Now it's time to enter into the Health Exchange chat room. So I have a wonderful sister in the Health Exchange chat room. I am so honored that she's taken the time to be with us. She is Mrs. Funke Bajomo. She is an event decorator. You need to check out her work. She does marvelous work. She's a freelance writer and a mother of three. So welcome, Mrs. Funke Bajomo.
Thank you. Thank you. Happy to be here.
Yeah, it's always wonderful to be in your presence. So, but you know that, we're talking about kidney. This is the Kidney Awareness Month, kidney disease altogether.
Just like any other lay person, kidney disease is very debilitating and it can affect a person's life very drastically. I know people with kidney disease really bad have to go on dialysis. And that pretty much, takes up a whole lot of their days. So it affects their life tremendously. Could be anywhere from 4 to 6 hours per day doing the dialysis, maybe a couple of times a week, just depends. I know a couple of people who have kidney issues. Well, more than a couple, unfortunately. But someone close to me had to go through dialysis recently. But fortunately, they were able to do just one. And the numbers look good, so they don't need it every day for now.
Right, absolutely. And you're so correct. It really does take a lot of time. Now, are you aware of some of the symptoms? How would anyone know that they have kidney problems? Are you familiar with some of those symptoms that people will complain of?
There are a few that I've heard of. I know people with kidney stones have excruciating pain in the back, lower back. People with just regular kidney disease have symptoms like yellowing of the eyes. They have pain passing urine. They have dark colored urine. Some people have pain, some people don't. Those are just some of the few common symptoms that I've seen.
Yeah. And then you say you're a layman. You're not a layman. You have
definitely a layperson.
Yeah, but you're right. It depends on the kind of kidney disease, right? Because I'm going to go into the discussion room and talk about the kidney and the different aspects of kidney function. So depending on where that problem is, will determine the kind of symptom. Now, another question. How can we prevent this? I think that is the 1 million question of the century. How can I prevent kidney disease? Are you familiar with some of those risk factors and some of those things? I guess if you know the risk factors, then you know what to prevent, what to do to prevent those risk factors. But are you familiar with some of those things?
Well, regular checkups for one, definitely. And some people are more susceptible to kidney disease, like if you have underlying conditions like diabetes. I know with my doctor, because of type 2 diabetes, they're always checking my kidney functions to make sure the medicines aren't creating more problems.
Yes.
There are people with sickle cell disease, and over time, their kidney functions decline. There are also people who might be a genetic disposition. I don't know, but just depends. I think some of the things that I've heard include using, what is it, cranberry juice. Drinking lots of
Yeah.
cranberry juice to flush out the kidneys. I don't know how apt
How
or
true
how
that is.
accurate that is, but I know a lot of people do it. Some people use herbal supplements. I've seen some from places like Renew Herbs. They claim to flush out your kidneys and keep it in good working order. But I think just a good, healthy diet generally, and lots of water, vegetables, and sometimes just cleansing out your system, flushing it and maybe going on some kind of cleansing regimen once in a while will help to keep the kidney functions good and give it a break from all the toxic food we eat.
You're
Things like
absolutely
that.
right. Yeah, you're absolutely right. You hit the nail on the head, and good hydration. I will definitely dive into the cranberry and where its role is, and then the herbal supplements. But you're absolutely right. Regular checkups. Get that checked,
Yeah.
as often as you go to the doctor. You are your own best doctor, really. When do you feel something off? I have my patients always asking me, what are my kidney functions? And I always feel glad when they ask me. And I tell
Yeah.
them, oh, we just checked it 3 months ago, so that's great. Well, I think we've come to the end. I'm curious if you have any question that you want for me to debunk going to the discussion room.
Well, I'm an advocate for using all natural methods whenever possible. I do not like medicine at all. So if I can avoid using medicine for anything, I will. If you could talk more about herbal supplements, which ones
Okay.
are good for us, which ones are harmful, just the natural ways we can keep our kidney functions up, especially for those people who have underlying conditions like sickle cell or diabetes or any other thing, that would be really helpful. And good knowledge is passed on to other family members, and we can cut those myths that are dangerous, and we can do the right thing. That would be really helpful.
Absolutely. Those, supplemental things that we can do that would keep us at our optimal kidney function.
Awesome.
Thank you so much for your time.
Thank you, Dr. Babs. Good talking to you. Bye.
The kidneys are a pair of fist-sized organs located at the bottom of the rib cage. There's one kidney on either side of the spine. Kidneys are essential to having a healthy body. They are mainly responsible for filtering waste products, excess water, all the impurities in our blood. These toxins are stored in the bladder as a safe house until they're ready to be removed during urination. The kidney also helps to regulate the pH, the salt, the potassium levels in the body, and it also produces some hormones that help to regulate blood pressure and control the production of red blood cells. So I tell you, the kidney is a powerhouse. As small as it is on either side, it is a powerhouse. It even helps to activate a form of vitamin D that helps the body absorb calcium. So damage to the kidneys can cause a lot of problems. Damage, whether it's from diabetes, high blood pressure, chronic diseases, whether inherited or non-inherited, they can all lead to problems affecting the filtration system. Now, we need to talk about what this looks like, all right? What kind of symptoms can one expect? But before we dive into that, because of the way the kidneys form, there are different aspects of that kidney that performs different roles, and hence the reason why different forms of diseases can give you different symptoms. Let's talk about the most common one. Chronic kidney disease is one of the most common form of kidney disease, and it's long-term condition that does not improve, unfortunately. Most common due to high blood pressure. High blood pressure is dangerous to the kidneys because it increases the pressure. Just as the word means, high blood pressure, it increases the pressure in the glomeruli. Now, what is the glomeruli? Glomeruli are tiny blood vessels in the kidney where the blood is cleansed. All right, so like if you go to a car wash, right, you go the vroom, vroom, the wipes, you know, it's always nice. So it's just cleaning and cleaning. That's what the glomerulars are. So over a long period of time, if the pressure is so high, it's just going to be pow, 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 pow. You know, you want to go into a car wash and just having a nice, enjoyable wash, not slamming and frightening you to death, right? So over a period of time, this high pressure can damage the vessels and the kidney function begins to decline. Kidney function will eventually deteriorate to the point that the kidney cannot function at its best. This is where dialysis will be needed to help take the place of the kidney's removal of excess fluid and waste materials. A kidney transplant might be needed at that point if the dialysis is no longer helpful. Diabetes is also another reason for chronic disease, kidney disease. High sugar, as you can imagine, that would damage the blood vessels in the kidneys. Over time, the kidneys will not function at its best. Kidney stone is also another one of those conditions that can affect the function of the kidney. Kidney stones leads to an obstruction, but before we get to the obstruction, these kidney stones occur when minerals and substances in the blood crystallizes in the blood, and then it forms these little masses, right? And when it forms masses, it causes an obstruction. Obstruction prevents urine from passing, the way it's supposed to. It becomes very painful. You can imagine urine trying to flow, and then its obstruction is trying to push its way through, rubbing against the kidney. It's definitely very painful. Another form of condition is Gummerolo Nephritis, and that just means an inflammation in the glomeruli. This definitely causes a lot of problems. It can lead to a lot of buildup of waste material, and the glomeruli problems can either be from infections, drugs, congenital problems. All right, so these are things that we need to look out for. Polycystic kidney disease is one of those other diseases. You've probably heard about a genetic disorder where the kidney just has numerous cysts and there's small sacs of fluid. Not the right way it's planned. The kidneys are supposed to be made, so they cause a lot of interference with the kidney function. A video on urinary tract infection it was last week, so check it out right after this video. This is when you have a bacterial infection of any part of the urinary tract, all right? It could be in the bladder, it could be in the urethra, whereas the entrance where the exit where the urine passes from the bladder to the outside world. So those are some of those conditions that can affect the function of the kidney overall. What are some of those risk factors, I'm sure you would ask? Some of those risk factors, as you've already alluded to, anything that affects either the vessels, either the structure of the kidney, any one of them can lead to kidney disease. So you could have the diabetes, the hypertension, the cyst, all of those are examples of risk factors. Now, what symptoms do patients or people that have kidney disease? They can be very fatigued because the kidney's just not working the way it needs to. They have all this toxic buildup, so they're just tired, they're overwhelmed. They can't concentrate because they have uremia. They have high levels of toxin, so the body can't focus, can't concentrate. They're not able to sleep. They have decreased appetite. If they have the stones, they could have a lot of cramp, a lot of pain. They could be puffy because fluid is not excreting the proper way. So they can be puffy, full and swollen face, full and swollen hands. They initially might have frequent urination, and then they can decrease to not even passing urine at all. These are some of the symptoms. It depends on the severity, will determine how bad the symptoms are. Now, in terms of complication, if it gets to the kidney failure, where the kidney just shuts down completely and it's not working, they can have some systematic symptoms, so things like nausea, vomiting, loss of appetite, decreased urine output. As I mentioned, some of them can be anemic because the hormone that is produced in the kidneys to help with red blood cells production is decreased and declined. It can also lead to decreased sex drive. Anything that just affects the way the body functions properly and it's excreted by the kidneys can also be infected. Can affect the heart, the inflammation of the pericardium. There could be fluid around the heart. So there's so many things that can go wrong with the entire body if the kidney, which is a toxic organ, is altered. So we need to be aware of these. Now, How do we diagnose? Now that we have an idea of what those risk factors are, we know what the complications are. The best way to diagnose definitely is clinical. So have that conversation with your doctor so that they can, take a good history, do a good full examination. In terms of laboratory, it'll be urine to check for white blood cell counts, to check for albumin, which is the protein that is not supposed to be excreted through the kidneys in excess amount. If that is high levels, that is a red flag. You can check for protein. If that is spilling out of the urine, that is also a red flag. You can do a blood test checking for your creatinine function. Creatinine is a byproduct. If it's an excess amount, then we know that the kidney is not working the way it needs to work. There's something called glomerular filtration rate, which is GFR, if you've heard that before. This measures how well the kidney is functioning, and it's in different stages. So those are things that your doctor can look out for. An ultrasound can also be done if you want to see the structure of the kidneys, see if there's any cyst formation, if there's any stone, if there's anything going on that might be leading to an abnormal result. So that's another way. Last way, some other ways could also be a biopsy, just to see if, take a piece of the kidney and see what's going on. Of course, this is done under sedation. Your doctor, you have that one-on-one conversation to see if you're at that stage that needs to be done. So these are some of the ways to diagnose. Now we've gotten to the point where we want to manage kidney disorder. Management, as I always start off with, starts with prevention. Prevention is better than cure. Dietary as well as lifestyle changes. Making changes in your diet profusely makes a difference, right? Because our health is our wealth. And whatever we feed our body will definitely in turn help our kidney function at its best. So if you have a family history of diabetes, definitely controlling that sugar so that the blood vessels are not destroyed. You want to control that sugar. You want to make sure you control your cholesterol so you don't have plaques all over the place destroying the blood vessels in the kidney. You want to cut back on salt. Salt is a culprit. High salt carries a lot of fluid. Excess fluid overload makes the kidney just overwhelmed. So cutting back on salt. That's why you hear your doctor say all the time, cut back on salt. Season your food with other powerful spices, anti-inflammatory spices. I do have a video on how to spice up your health, so make sure you check that right after this video. You want to eat a heart healthy diet, which is also a kidney healthy diet. So fresh fruits, veggies, because they have all the nutrients that your body needs for the kidney to function at its best. Whole grains, low fat, dairy products. Limit alcohol and smoking. I know we are creatures of habit. There's no judgment here. If you smoke or drink, just speak to your doctor to find ways to help you cut back, because ultimately that will save your kidneys. Kidneys need to have the proper blood vessels and blood flow, and whenever you use illicit drugs, smoke alcohol, it alters the lining of your blood vessels in the kidney, ultimately affecting the kidney function. So those things need to be put at a minimum, if not completely abstain. So there's a category that can affect the kidneys if you do it in excess amount, and that is physical activity. Now, don't get me wrong, exercise is good, but if you do it to the extent that it overwhelms your muscle, it's going to break down and produce a pigment which, when secreted into your bloodstream, can damage the kidneys and cause what we call ribomyolysis. So we have to be very, very careful to not over exercise, just to exercise as tolerated. When you will become overly sore and you're not staying hydrated, that can cause a lot of problems. All right, so we need to be very careful. Being dehydrated doesn't help the kidneys at all, as you can imagine. There's some pain medications, or medications generally that can affect the kidney, especially medications that are NSAIDs, the ibuprofen, the naproxen, the Advair, all of that over a long period of time absorbs a lot of fluid, can damage the vessels if you take it all the time. Acutely, yes, as needed, but not a long period of time. Now, there are certain foods, again, as I mentioned, that have high protein, depending on what's going on with you and what other conditions you have that you want to be mindful of. Animal protein, like beef, you have to be careful. That sometimes can increase the uric acid, causing a lot of problems with the kidney. All right, so now how do we treat? Now that we know how to prevent it, right? So if you have any chronic conditions, just be careful, keep them under control. If you have any habits that can worsen the kidney function, reduce taking those. Treatment, again, it depends on the underlying cause. You treat the underlying cause, you treat the kidney problems. Ultimately, there are medications that are used to preserve the kidney function. Medications known as the ACE, you might have heard them, the lisinopril, the ramipril. You've probably heard a few of those, or lostatin. These are good blood pressure medicines that at the same time, if there's blood pressure, can reduce the blood pressure and also preserve the kidney function or slow down the progression to kidney disease. So that is one really good medication. Definitely, if you have high cholesterol, you have to have that conversation if you're a good candidate for cholesterol medicine. I always go for preventing having to be on medication altogether by just eating properly. You know how I always say that if your food is right, there's no need for the medication. Dialysis is one of those other treatments, as alluded to at the beginning. Dialysis is where it takes the place of your kidney, where all the toxic waste is taken out of your body, so that your body can function at its best. And it's an artificial method for filtering the blood. It's used when somebody's kidney has failed and it's so close to failing, it's at the end stage. Kidney transplant is also a last resort. So those are some of the treatments, but definitely you have to have a conversation. I'm hoping that you don't get to that stage where you would need either one of those two methods. Now, what are some of those messages we want to debunk right now? As my guest mentioned, what are those natural things that we can use that can prevent kidney problems? Definitely, as natural as it gets, is hydration. Water, water, water. Drink your water. I'm thirsty, actually. Where's my water? I need to drink some water. We need to drink water. It's usually recommended 64 ounces of water a day, and that is 8 cups. If you can cut it to 12, depending on if you don't have congestive heart failure and you don't have anything that you need to limit your water intake, you need to stay as hydrated. How do you know? Check your urine. If it is so bright and it has an odor, then that means you're not drinking enough. I know a lot of us are not able to drink water. We don't feel like drinking water, but we got to do whatever it takes to drink that water. I put a lot of lemon slices, I put cucumbers, anything that would just make me drink water. I do it so that I can stay well hydrated and my kidney can thank me for it. So those are some of the things. There are some things that you can put in your food, in your drinks, that will help you stay hydrated. So lemon juice has a lot of citric, which helps to prevent kidney stones. It gets rid of the calcium. It also helps to break up all the stones. Another thing that helps is basil juice. I've heard a lot about basil juice. It contains acidic acid that helps to break down kidney stones as well. Just prevents any alkalization of the urine and reduces pain. There is apple cider vinegar. I love apple cider vinegar. It also has acetic acid. This helps to dissolve kidney stones if there is kidney stones. It also helps to flush out the kidney, helps to ease any pain. Apple cider vinegar has a lot of beneficial properties. Now, be careful not to just take it by itself raw. You want to mix it in warm water or some form of water because it can affect the teeth and enema. So you want to be careful with that. All right. Now, celery juice. Celery juice is one of those things that help to clear toxin from our bodies altogether. It is a traditional medication. So celery, I make a lot of celery juice. I just drink it. It helps to flush all toxins out of my body. I blend it with other things. The pomegranate juice is also one of those great ones that help to improve kidney function. Cranberry juice, as my guest had mentioned, that usually helps with urinary tract infection. And that's because the chemical that is in the cranberry, provided you're not taking the one that has so much sugar, has been shown to clean out the lining, heal the lining of the urinary tract so that it gets rid of infection. But again, make sure that you have this conversation with your doctor so that they can personalize it to your care. Other things that we have seen that helps in terms of herbal or natural things is kidney beans broth. This is a traditional dish which has been often used in India that says it helps to improve overall urinary and kidney health. It helps to dissolve and flush out stones. So a lot of these are referring to stones. Ultimately, it helps with the kidney function. And the last one that I want to mention is called the Dandelion root juice. It helps to stimulate the production of bile, and it's thought to help eliminate waste and increase urine output and improve digestion. It also has a lot of vitamins A, B, C, and D, and a lot of minerals, potassium, iron, and zinc. So while we're talking about potassium, iron, and zinc, be wary though that if you have any kidney problems, don't overeat anything that has too much phosphorus, too much protein, or anything that has high potassium. You want to make sure that you know what your numbers are. That's why you need to be empowered to know what your numbers are. What is your creatinine level? What is your GFR? Make sure that you're not spilling any glucose. Make sure you're not spilling any protein, and so that you can eat, you know, regular eat, you're not eating anything in excess. Bananas are known to have a lot of potassium. Pickles have a lot of sodium, so you have to be careful with that. Even avocado, as great as it is, if you have anything that increases a lot of potassium, you got to be careful with that. All right, so your dietary restriction and nutrient intake recommendation will vary depending on the severity of any kidney damage that you have. That's why you have to have a sit-down conversation with your healthcare provider. Thank you so much for hanging out with me to the very end. There's been a lot of information about kidney health as we are in the Kidney Month awareness. We want to empower ourselves to know about our kidneys and make sure that our kidneys, you know, are healthy as long as possible, right? And I know that we can do this together. So I want you to make a commitment. What are you going to do with everything that we've heard? Are you going to increase your intake, your water intake? Are you going to make sure that at your next doctor's appointment you ask about your kidney? Don't leave it up to your doctor or your healthcare provider. You ask about what your numbers are. Ask the doctors to explain your numbers to you. Know what your risks are. Know how to prevent them. If you have any of those habits like illicit drug use, if you're using ibuprofen over the counter, cut back on those. All right, so these are the information that I have impacted. I hope that you found some value. Please do not forget to leave a statement. Let me know how it's been helpful. I would like for you to subscribe, all right? Take a minute, subscribe so you don't miss any helpful information. And share. Sharing is caring. We are healthier together when we learn from one another. So until next time, when we hang out together and Living at Your Finest with Dr. Babs Health Exchange Chat Room, I want you to remember that we together can triumph as health champions because we need to, we deserve to, and we most certainly can achieve to live at our finest holistic health. Wishing you the finest week. Thank you and God bless.